Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.
Good morning, everyone, and glad to have you with us today. Obstetrician Dr. Judette Lewis specializes in high-risk pregnancies at Metro Health Medical Center. She's here to talk about her work with patients and her research on sleep apnea in pregnancy. Then we will hear from Crystal Murphy and Karen McHenry, who will shed some light on human trafficking. Later in the broadcast, Christopher Jerry of the Emily Jerry Foundation will tell us what he's doing to prevent medication errors. Good morning again. This is Kaleidoscope. I'm Leon Bibb, and so we begin. Beginning right now with Dr. Judette Lewis, who's with the Metro Health Medical Center, an obstetrician there. Good to have you with us, Dr. Lewis.
Thank you for having me.
You are here to talk a little bit about high-risk pregnancies. What are the red flags that are waving for high-risk pregnancies?
Number one, people who decide that they want to get pregnant sometimes have medical conditions or they're on multiple medications. Those pregnancies are at risk. They're at risk for pregnancy loss. They're at risk for adverse effects on the baby. And then there's also the mom's health that can sometimes get progressively worse over the course of that pregnancy. So in the field of high-risk obstetrics, we say that we know these women still want that happy outcome, and we're here to try to help them get to that happy outcome.
Yeah, I know you don't have your books and your things with you, but maybe you can tell us what percentage of pregnancies would you think, or would you guess or estimate are high-risk pregnancies?
It depends which populations you're talking about, but now with the higher rates of obesity and women waiting to get pregnant until a little bit later in pregnancy, I would say about 10 to 15% of them.
Typically, at what point in her pregnancy does an at-risk mother see you for care or consultation?
Most often, it's after they've had their first visit with their general obstetrician who will be delivering them. There's a small subset of people who will see me even before they get pregnant, so that I can discuss with them what they should be doing, what kind of vitamins, which medications they should come off of, and also to discuss a preliminary plan for the pregnancy. And I think that's always a good idea.
Now, doctor, I know you've done some research on obstructive sleep apnea in pregnancy, and I want you to talk a little bit about that. But first, I want you to tell us, what is sleep apnea?
So sleep apnea is a condition where during sleep, an individual essentially stops breathing. Their airway is blocked off either by their tonsils or thickened tissue in the airway, and air stops moving. The problem with that is if air stops moving, then your oxygen levels go low. And your body responds to that by waking you up, but then it also responds by increasing your blood pressure and having a lot of other effects that can increase your risk for heart disease.
Now, what would that do for a fetus in the woman's womb? What would that do to that fetus, that child?
So that's the big question that we're studying. And what we have found so far is that at minimum, it increases the chance of that fetus being born preterm. And the reason that fetus is being born preterm is because the mom develops high blood pressure, and it develops a condition called preeclampsia, and because of that preeclampsia being severe, we are increasingly needing to deliver that woman early. So it causes a detriment to maternal health, but then also to the fetus too.
You continue to do your studies in this. The study is still open? Are you still looking for participants?
Yes.
Who do you need? Who do you want to see come in and help you do the research that you're doing?
Well, we have two studies going on right now. The first one has approximately 160 women, and we're looking for women who are overweight or obese, and we're screening them for sleep apnea. The second study is a larger study that's being actually funded by the National Institutes of Health, where they're looking at 3,600 women across the country, and these are first-time moms, and that's regardless of weight or medical conditions, that they're testing them for sleep apnea, so we can get an answer for once and for all about what the risks are for these women. And
can people call you or contact you to get in line for this study if they would like to help with
Absolutely.
this? Let me put some information on the screen. You can go to sleepdisordersinpregnancy.com, right? You can get more information on everything we're talking about, or you can telephone that number on the screen, which is 778-5498 in the 216 area code. How long are you going to have this study open?
So the first study, which I talked about, in which we have almost 200 women, we're going to keep enrolling through the summer. so pretty much will end in September. The other study goes on until next spring.
Now, this is all part of the Division of Maternal Fetal Medicine at Metro Health Medical Center?
That is correct.
You do a lot of things over there. There are a lot of things happening there.
Yes.
Talk a little bit about what that division does at Metro Health Medical Center.
Well, we focus a lot on high-risk pregnancy. We particularly, we are one of 13 centers across the country who studies the complications of high-risk pregnancy. We have a prematurity clinic, we have a diabetes clinic, but outside of those two diabetes and prematurity clinics, we also have a separate clinic to focus on medical complications. So people who've had heart surgery, or people who have been on blood thinners, or individuals who have told never to get pregnant, they can come in and see us, and we can go through their history and take them down the different paths and let them know what their alternatives are.
Dr. Judette Lewis, obstetrician at Metro Health Medical Center. Let me ask you, for women who are considering pregnancy, when is the best time to see you about this?
If you have a high-risk condition, I actually say before you even start trying. Because when you come in, we can look at all of those medications and decide which ones are safe and which ones are not safe for pregnancy. Start you on folic acid, which we know prevents neural tube defects. Start on prenatal vitamins, and also lay down a preliminary plan so you know what to expect once you're pregnant.
And if somebody has sleep apnea already but is not pregnant, what is your advice?
One of the biggest things about sleep apnea is that we have found even if they don't have high blood pressure and diabetes when they were diagnosed, they have a higher chance of developing it. So we are adamant about those women first being tested for diabetes. Because diabetes, if it exists while you get pregnant, we know increases your chance for miscarriages and birth defects.
Dr. Judette Lewis, obstetrician at Metro Health Medical Center. We appreciate you being with us. 778-5498 is the telephone number in the 216 area code, or sleepdisordersinpregnancy.com. More information on everything we've been talking about, including getting in line for her study, for your study.
Yes.
Good to see you, doctor.
Thank you
the
for having me.
doctor is in the house. I know you're saving a lot of lives out there, and you're helping a lot of women and families too, all of us.
That's our goal.
Thank you very much, Dr. Judette Lewis of Metro Medical Center. I'm going to take a break. This is Kaleidoscope. In a moment, we will return. We'll talk about the second largest criminal industry in the world. It has to do with human trafficking. After this. And welcome back to Kaleidoscope. Good to have you with us. Crystal Murphy calls herself a modern-day freedom fighter, and she works with the Jade Rescue Project and is joined today by Karen McHenry this morning, and they will share with us information about what is considered the second largest criminal industry in the world, and that is human trafficking. Karen McHenry sitting on your left, and Crystal Murphy sitting in the middle here right next to me. Good to have you both with us. Crystal, let's begin with you simply because you're sitting next to me.
Okay.
What is human trafficking?
Well, human trafficking, it really is modern-day slavery. It's the taking of people through force, fraud, or coercion, and it's forcing them into modern-day slavery. There are two forms. There is labor trafficking and sex trafficking, and they are both happening here in the United States.
Okay. And Karen McHenry, you are going to tell us a little bit about the typical victim in human trafficking.
Really, the most alarming part about human trafficking is that the age is really 12 to 14. So these are young girls, young boys that are being groomed, they're being lured, they're being manipulated into these sexual trafficking situations. And we have a hotline for kids that are homeless and out on the street. So 24 hours a day, a kid that's in trouble can call us that needs help. And that's 24 hours a day. If a kid's concerned about another friend or a parent's concerned, law enforcement calls. And so we know that our kids are at risk once they're out on the street, because once a kid's out on the street, within 72 hours, they might be solicited for sex. So it's very important. These are kids that are looking for a stronger sense of belonging, that are maybe having some stressors at home, and so they found somebody that's older that appears to be taking care of them, but they have other objectives and things that they're going to use them for.
So your organization, Belfair JCB, is very much involved in this?
Yes, through our homeless youth programs. We are very much trying to get these kids off the street.
Crystal Murphy, what brought you to this? You call yourself a freedom fighter with the Jade Rescue Project. Tell me about that.
Well, when I heard about human trafficking, it was in late 2008, and when I heard about it, I couldn't believe that it was actually happening. And when I found out about it, I said, well, this can possibly be happening in the United States. And to my surprise, it was happening in the United States. Toledo, Ohio is number 4 in the nation. It's a major human trafficking hub. So we have a major human trafficking problem right here in the state of Ohio. The person responsible for this study that mapped Toledo, Ohio as number 4 in the nation says that Cleveland is actually worse. We just haven't had the same things that Toledo has had to identify the problem.
What kind of assistance is available for victims who have been rescued?
Unfortunately, if you are an American citizen, there are not a lot of resources, because for so long this was thought to be a overseas problem. It wasn't happening here. But the Cleveland Rape Crisis Center has been very active in helping victims, and then the collaborative initiative to end human trafficking is able to help victims of trafficking as well.
We've got a couple of phone numbers I want to put on the screen. We're going to try and keep them up for a while too, because of the gravity of what we're talking about. 216-526-8628 or 320-8422. You can get more information on everything that we've been talking about. And Karen, I want to come to you. Who are the perpetrators in this human trafficking industry?
Who are the offenders, the people that are luring them?
The offenders.
You know, you would typically think that this is an older man, but it can be an older woman, an older man that sometimes is dating a younger teenager, puts themselves in a situation where they become friends with them, and then they start grooming them, and then they lure them into these situations. So these are just people out on the street, and they sometimes can be from in their own family. They can be people that they've known for a while, and that's why this is so dangerous, and that it's really important. These people also meet the kids at also different medias now. They can get them by texting, they can get them through the internet. That's why the internet sites, it's so important to supervise what your children are doing on the internet, because they can put themselves on the internet as, I'm your 14-year-old friend, meet me down the street. When you get down the street, it's a 28-year-old man.
Karen, there may be somebody out right there who is a victim right now listening to our voices. What can you tell them in the minute we have remaining? What can you tell them? Where can they call? What can they do to get away?
Well, the first thing is reach out for help. There is help available. The more victims that we're able to identify, the more we're able to put resources together. There is a national human trafficking hotline that can be called. It's 888-37-37-888, and that's the National Human Trafficking Center, and they can connect a victim with resources as well.
888-37-37?
888.
And they can also call the numbers we've been talking about. Are we making a dent in this problem, and do we have the muscle to make this happen in the United States?
Well, I think just by talking about it today, that hopefully we're increasing some awareness about it, that people know that there are kids that are trapped. And so if you see that there's somebody that you're worried about, to do something, make a phone call. You can also call the FBI, which is 216-522-1400, and they're also willing to intervene and help and make sure that these kids are safe and getting off the street, because the most dangerous thing is that they're out on the street.
And if somebody didn't get those numbers, they can simply dial 0 or dial...
Yes, and they can always go to our website, and we can link them to additional resources.
Okay. Many thanks for being with us. Crystal Murphy, who's a freedom fighter with the Collaborative Initiative on Human Trafficking, also the Jade Rescue Project, and Karen McHenry, who's with Belfair JCB. We appreciate you being with us. Also, there's a website, BJCB, that's belfair.org. You can get more information on everything we've been talking about. We're going to have you two back, because I want to continue the discussion one day soon.
Okay.
Thank you so much for being with us.
Thank you for having us.
I've got to take a break. This is News Channel 5's Kaleidoscope. I'm Leon Bibb. We'll be back and talking about protecting you from medication errors. But first, these words. You're in touch with Kaleidoscope. Glad to have you with us today. The president and the CEO of the Emily Jerry Foundation is working to prevent medication errors at pharmacies and medical facilities around the country. Christopher Jerry is here to talk more about this issue. Hello, Christopher. How are you?
Hi, Leon.
Good to have you with us. What's the mission of the Emily Jerry Foundation? I know it is named in honor of your daughter.
Yes.
In memory of her. What's the mission of it?
Well, my 2-year-old daughter, Emily, died as a result of an unfortunate medication error back in 2006. And the mission of the foundation that I've established is to, number one, improve legislation, to provide training, better training and oversight by the various pharmacy boards in the different states to prevent medication errors.
You have been successful with that. There's an Emily law in Ohio.
Yes.
And basically, in a couple of seconds, what does that Emily law say?
Emily's law provides some regulation, training requirements, and oversight by the Ohio Pharmacy Board. It was passed in January of 2009 and signed off on by Ted Strickland. Prior to Emily's law, there was no oversight in the state of Ohio, or training requirements, or any requirements whatsoever for pharmacy technicians.
Well, our sympathies on the loss of your daughter, who I understand passed away in 2006. Is that
Yes.
correct? Yeah. Basically, what happened? What was it that went wrong?
What went wrong, Leon, was she was in the hospital and had just miraculously overcome cancer. She had had a grapefruit-sized tumor in her abdomen, and the tumor had all but disappeared. Her oncologist had recommended one more final round of chemotherapy, and just to make sure that there wasn't any residual cancer cells that could arise later in life and cause her problems. And a pharmacy technician who didn't know any better, wasn't trained adequately, instead of using a standard off-the-shelf bag of saline, which contains 0.9% sodium chloride, she loaded up an empty compounding bag full of 23.4% sodium chloride. And that causes cerebral edema, or brain swelling.
And there was the difference right there.
Yes.
You are pushing for a national law. You want an Emily's Act. Tell us more about your efforts in that regard, Christopher Jerry.
Well, I'm currently, I just got done establishing the foundation. We just received our 501c3 status in February of last year. So the foundation is still in its infancy. And so I'm still getting a lot of these programs and activities off the ground. And right now I'm currently looking for the appropriate congressman or congresswoman to sponsor Emily's Act. And Emily's Act will be structured very similar to Emily's Law in the state of Ohio.
So you're looking for someone to take to help you run the ball.
Correct.
And you're living here in Northeast Ohio.
Correct.
You're here in Northeast Ohio.
Yes.
So you're looking for somebody at the national level. That means a congressman,
yes.
One of our congressmen, or one of our two senators from the state to help run the ball for you.
Correct.
We wish you well. Let me put a phone number on the screen here for more information. People certainly want to ally with you on this. 440-289-8662 is the telephone number you see at the bottom of the screen, or you can go to emilyjerryfoundation.org for more information on everything we've been talking about. You've been working with medical equipment manufacturers as well.
Yes.
Speak to that a little
bit. I'm currently trying to set up an endorsement or sponsorship program for companies that have clinically proven medical equipment that has clinically proven efficacy to immediately begin saving lives upon implementation into the pharmacy workflow and or the OR. A few of those companies are companies like C Medical out of San Jose, California, another company called CDEX, and a third company out of Cleveland, Ohio, a company called Codonics.
So you're working with them to raise the level here.
Yes.
To raise the bar on the things that we need to be looking at when we get to medical equipment. And I've got about 40 seconds remaining. I want to ask you, for the everyday person out there, when we receive medication from the pharmacy, what's the first thing we should do when we get that medication from the pharmacy?
I encourage everyone to research the medication that they're taking on the internet, find out what the medication looks like if it's in pill form and what have you. One of the things that I recommend when people go into the hospital to receive treatment for any type of procedure where they're going to be staying for a while, is it's fully within your rights to make a request with the facility where you're staying to have a registered pharmacist prepare all IV medications during the course of your stay.
And just recheck that medications that we're taking.
Correct.
Yeah, we're running out of time, but I want to have you back. I want to continue the discussion one day, and we'll have to bring you back to talk more about your quest for an Emily's Act nationwide.
Yes.
But once again, we're talking to Christopher Jerry, who's president and CEO of the Emily Jerry Foundation, named in memory of his daughter.
Yes.
Thank you so much, Chris.
Thank you, Leon.
And good luck to you.
Thank you so much.
And I hope you can find that congressman or that senator.
Yes.
They're out there. We know who they are.
Yes.
Okay, you know where to knock on the doors, too.
Yes, sir.
I'll take a break, and we'll be right back. This is Kaleidoscope. Back in a moment.
Thanks, Leon.
Yeah. We're partnered with the Urban League of Greater Cleveland on this broadcast, and with us now from the Urban League is Keithan Gale, who's going to talk a little bit about where we are with the college tours, the historically black college and university tours for high school kids.
Yes, sir, Mr. Bibb, thank you for having me. We are actually getting ready to head out on April 17th. We have 2 tours running concurrently, one northern, where we'll be in parts of West Virginia, North Carolina, into Kentucky, down into parts of Tennessee, Nashville, and Memphis. And our southern tour is heading into Arkansas, Missouri, parts of Texas, in terms of Texas Prairie View A&M and Texas Southern, heading back up through Louisiana into Mississippi, and we're also going to meet in Memphis, Tennessee.
And the high school kids are already in line for this now.
Oh, yes.
We filled up the tours. We got a minute remaining. We filled up the tours,
yes,
and
sir.
now you need some help to help cover some of the costs for these tours.
Absolutely.
For the kids visiting colleges and universities.
Absolutely. Absolutely. So what we're trying to do right now is just try to generate as many funds as possible. We've had some generous donations from various people, such as Macy's, U.S. Bank, Mr. Burt over at Dave's, the Men of Harambe. Very, very great donation, but we need more. We're trying to raise about $4,000 or $5,000 at this point.
Because each tour for each kid costs about $550 in our remaining 30 seconds.
Absolutely.
About $550.
And that's not including meals.
Yeah, so this is fully chaperoned and all. The kids are in good hands.
Absolutely.
And this whets their educational appetite for college. These are high school kids from the greater Cleveland area, and they're going to find out what life is like on college in a week's tour.
Absolutely.
Okay.
Absolutely.
Right. So what should people do? Contact the Urban League?
Contact the Urban League as soon as possible. All monies will be due by April 15th.
622-0999 and the 216 area code. That's it. We got to go.
Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.